your general anatomy. All of these things I have to take into consideration when I'm seeing somebody and they ask, what can you do for my neck? Okay. So for younger patients, the most common complaint is they have too much fullness in this area. It's too fat. It looks too fat. So if that fat, there are two very popular non-surgical treatments that can be used to treat extra fat that's underneath of the skin. Hi, everybody checking in. Thanks for checking in, joining. Those two popular treatments are cool sculpting, something called the Cool Mini, and also something called Kybella, okay? So if it's just fat right here, cool sculpting, there's actually an applicator for the cool sculpting device that fits right underneath of here, and it works great. So after about an hour or two, depending upon whether you need one or two applicators, your treatment can be done. Now, cool sculpting will give you about a 20% reduction, so it works very well. You can repeat it if it turns out that it doesn't work enough. Rarely will patients need more than 2 treatments with cool sculpting. And I always compare these non-surgical treatments with liposuction, because liposuction is also very easy. It's surgery, but if you just need liposuction of your neck, it's an incredibly easy procedure to do and a very fast recovery. The benefit of liposuction over cool sculpting and Kybella is basically it's a one-stop shop deal. It's immediate gratification. So with cool sculpting, you need to wait for the effects of the cool sculpting to work. Same with Kybella. With liposuction, the fat is removed like 100% of it, or as much as correction as you need. With the cool sculpting, you get about a 20% with a correction. So if you want more of an immediate one-stop treatment, liposuction is still the gold standard to which all of these non-surgical treatments are measured against. So then now Kybella. Kybella is an interesting story, because remember how a common theme that we keep coming across is medications that were sort of discovered from side effects of other things. So Kybella, not exactly that, but what Kybella was is an offshoot of something that was called mesotherapy. So mesotherapy has been practiced probably for centuries. It used to be done in back alleys, I think more in Europe than anywhere else. Gypsies, non-medical professionals would perform fat reduction procedures where they were injecting something into the fat and then the fat would dissolve. This was going on for many, many years, again, decades, if not centuries. And so somewhere in the 90s, it became much more popular in salons, at least in the US. It became so popular that it caught the attention of the medical professionals, right? Like what's going on, not only to understand what was going on, but also for safety reasons, because sometimes the things that were being injected were not safe and would cause problems, okay? But it turned out that there was this company that took an interest in this, eventually called Kythera, and they figured out what the successful solutions were that these people were using, the more successful injectors. Turns out it's something called deoxycholic acid, which turns out to be a bile acid, which turns out to be a natural ingredient in your body that your body secretes that helps to break down the fat when you eat it, right? So this is a natural occurring chemical that your body makes that this company figured out how they are just going to make it in a bottle, right? So very clever, and as it turns out, they've, it's a very predictable kind of medication to be able to use. And just as an aside, if you have kids or if you're interested in the entrepreneurial development of that whole thing, it's very interesting because Kythera was eventually bought out by Allergan, and you'd have to read about the whole story, but very interesting how somebody with such a simple idea of like finding out what's going on can develop it into a very big business. So Kybella, the product Kybella, it's a a solution that is injected, small little teeny needles, into the area of the fat, and it can be extended down, well down into this area, whereas cool sculpting has a little bit of a limitation because it's really just used for right through here. So one advantage the Kybella has is that you can use it on a larger area, okay? The disadvantage of Kybella is it does tend to take a little bit longer, and it's a little bit unpredictable as far as who's going to get what kind of a result. It does work. There's no question that it works, but it's hard for me to tell a specific person, oh, it's going to take you 2 treatments, and each treatment you have to do 2 vials, or it's going to take you 4 treatments of 4 vials. That's the hard part. So Kybella also has a little bit of a recovery to it, where it doesn't really hurt because we numb up your skin. It doesn't hurt at all, but you will get a reaction. It looks like a giant bug bite underneath of your neck in the treated areas, and it lasts for about 2 to maybe 3 days. So it is a little bit obvious right afterwards. But looking sort of back to normal, it takes about 3 days. And then with all of these treatments, it takes about 6 weeks to start seeing the results. The skin is a little bit numb for both of them. It's a little bit numb longer with the Kybella. But both are great treatments. And so it really depends on the skin quality as far as whether or not you'll get a good result removing the fat and not have loose sort of hanging skin. And at that point in time, then that's when we have to talk more about surgery, which I'll do in a second. But I wanted to answer the question that I asked you. What animal has a very large active platysma? The answer, a horse. Because you know when you see a horse and the flies are getting onto it and they're like twitching, and that's the platysma muscle. And so that's your fact for the day. So I'm going to take a 2-second break here because this seems to be a good spot to change, I'm thinking ahead. And so now I'm going to talk with you about surgical treatments to the neck. And again, we have issues with the skin, we have issues with the fat, we have issues with the muscle, and we have issues with things that are underneath of the platysma muscle, such as fat, additional muscles up in this area, and a salivary gland. So surgery has a role when, one, there's more problems than just the fat that's right here that we talked about, non-surgical treatments. And 2, the issues can't be dealt with by the non-surgical treatments, such as these kind of bands, right? So cool sculpting and Kybella aren't going to do anything for these bands. Sometimes you can do a little bit of Botox can help, but in general, it's so-so. Results of Botox are sort of so-so in the neck. But if there's too much bulging, if there's too much fat that's actually underneath of this muscle, neither cool sculpting nor Kybella will get to it, okay? So this is why an examination is so important, because these are the things that I need to be thinking about when I examine you, what my recommendations would be. So the surgical ladder, right, starts with liposuction. Liposuction is great for removal of fat, giving you a much better contour, but you need all the other elements to be in good position. You need good muscle definition. You don't need as much you can't have as much bulging down in here. You don't want fat underneath the platysma, because that fat is very difficult, if nearly impossible to get to with liposuction. And you need good skin quality that's going to shrink on the new shape, right? So that if you have liposuction, the fat's removed, but then you need your skin to shrink on that new shape, okay? So the bottom floor is liposuction. You take one step up and you have something that I call cervicoplasty. I think most people call it a cervicoplasty. But that's an operation that deals with all of this stuff very, very well, but doesn't remove any skin, okay? It's done through a very small little teeny incision that's underneath your chin. It heals very, very well. Probably better for people like under 50, where they still have pretty good skin quality here that's going to shrink. But with that procedure, you can take out the fat that's needed underneath of the skin, the subcutaneous fat. Then I'm looking directly at the muscles, and I can go in underneath of the muscle, remove the necessary fat, change the shape of the muscles if necessary. That usually does not have to happen. And even possibly do something with the glands. And then finally tighten this muscle like a hammock, okay? So then the muscle is tightened, and the skin will shrink on that new shape, okay? So again, a cervicoplasty is a smaller operation, quick recovery, done through a single small little incision that's underneath of your chin, changes all the architecture, but relies on your skin to shrink down on the new shape. Great operation, okay? It can also be done with combinations of other operations also, even sometimes chin implant or doing something else to help accentuate the shape of your neck. But we're just talking about neck right now. Thanks for coming in. Hey, Mom. Had another good Zoom this weekend. If you haven't been doing the Zoom, it really is pretty incredible. So Zoom with your friends and family. Anyway, so we talked about liposuction, we talked about cervicoplasty, and now we talk about a neck lift, right? So a neck lift is when this skin is not going to shrink enough for the cervicoplasty, and you have to get rid of it. You have to tighten it. When patients want to say they want their neck to look tighter, okay, we're moving more into a neck lift. So what does a neck lift do? It incorporates everything that I just told you about the cervicoplasty in the front, and then removes the skin from the back, okay? So you can see, if you're pulling back here and you want all the skin to be tighter, you're more likely going to need a neck lift than just a cervicoplasty. And that's, again, this is an examination. This is what takes me time to speak with the patient and understand what you're really looking for in order to give you the best result, or at least offer you the best result, right? So this neck lift, remember when I was telling you about the hammock effect in the front to sew this muscle, okay? Once this muscle is sewn in the front, you can also then pull the muscle in the back, okay? And that will help to tighten this area down more. So you need some sort of an approach, what we call an approach, from the back side in order to give you that result, but then also getting rid of that skin, which will tighten this area, okay? So we have liposuction, cervicoplasty, now a neck lift, okay? Neck lift, and then, so what do we do then if we're worried about the jowls? That's what I consider the separation from neck procedures, only neck procedures, to now getting into your face. Because once I start dealing with your jowls, that's when I start saying you need some type of a facelift, right? So you could have just a lower face, you could have a full face, you could have face with a mid face, you could have all these other combinations. But if someone says they don't like their neck, they don't like this, and they have jowls, and I only do a neck lift, it's not going to address the jowls, and then they're not going to be happy. So that has to be, I have to really discuss this with the patients ahead of time to make sure that they understand that neck procedures do not need to and will not affect the jawline up and through here in their cheeks. The recovery from these procedures of the neck, forget face for right now. I love facelifts, but we're going to talk about just neck. The recovery for neck lifts is typically faster than it is for facelifts, okay? Facelifts, generally, you're out of commission for about 2 weeks, I think, and neck lifts, you're really just out of commission for about a week. The scars or the incisions are generally from here back, so when you do a neck lift, there's no scars in this area. It's really just from about here in the back. I try to conceal the scars into the hair. The other ones are right way back in the crease, so you're not going to see them. You look pretty presentable by the end of a week with maybe a scarf, because you do get a little bit of bruising that's down and through this area. Usually the swelling is not bad. You can be Exercising, really light exercise